Ready.
I'm ready.
So I'm going to make a statement first, and then y'all can ask me questions. So, we have definitely seen a jump in the number of COVID patients. I'm sure if you're watching the data out there, you've seen the percentage rates have bumped up in Missouri. I think we're in the top 5 highest positivity rate in the nation. Kind of depends on who you read. Yesterday in Becker's, we were top 5. With positivity rates, and it's due to low vaccination. So what are we seeing here? So today we have 26 patients in our hospital, maybe 27. We may have one in the ER, I'll find out, but we have 26. 20 of those are on the 5th floor. Okay, that's our COVID pandemic unit. We have 5 in our ICU, of which 1 is ventilated. So we have a segregated ICU unit. Once we go past 4, we segregate our ICU unit. We do have 1 patient holding in an area of the hospital in droplet isolation. We're awaiting a test to come back. And then I believe we have 1 holding in the ER is where we're at today. So our numbers went from being in single digits to in double digits, and now we're in the mid to higher 20s. Our positivity rate last week was over 18%. The 2-week running average was over 16%. Presently this week we're running close to 18%. Again, we'll know by the end of the week Saturday. With that positivity rate, if you look back over the history in our hospital, looking at the number of patients we've had, we can expect to have 30 to 60 COVID patients in our hospital over the next several weeks at one time. Now, will we hit 60? I do not know, but we could. I'm not trying to inflame things. I just want to tell people the facts. What do I want to get out? I want to get out how hard our caregivers are working. And this is everybody, and I cannot say this enough about our folks that clean the rooms, our dietary folks that are in there, our EV, our grounds folks that are keeping this place looking so nice whenever you come here to having a healing experience, our nurses, our techs, our docs, our pharmacists, spiritual health. When you have COVID, you're usually in the hospital for a long length of time. These people become your family. And in many cases, people do not survive. We had our first death just a few days ago. It had been several weeks since we had anybody pass from COVID. That was a very sad day to know that once again we have people dying in our hospital from this disease. This is incredibly hard on our caregivers who care about this community, and they become everyone's family. And then to lose your loved one to an illness like this, which has already claimed over 600,000 lives nationwide, is very disturbing. So what is my one thought to everybody? Get vaccinated. Use common sense. Use good hand hygiene. If you don't know the status, even, wear a mask, okay? Protect yourself. We don't want you to become ill. We don't want you to become hospitalized. We are seeing a younger population become infected. However, we still are seeing those older or those with multiple comorbidities, that's multiple other illnesses, become more ill and require hospitalization. Okay? So the name of this game hasn't changed. The virus is still very lethal, and that's where we're at today. We have had some folks who were fully vaccinated become ill. We have had some caregivers become ill. This was from outside exposure. By our tracing. They had been fully vaccinated. It is less than 5% of our total vaccinated staff that has had this happen, much less. We will continue to monitor this so I can get a more accurate number, but right now the vaccine is still proving to be very, very effective. We have had a couple of inpatients that were positive, and they had been fully vaccinated. Okay? Only of those, over the course since vaccinated started, has 1 become severely ill. That patient had multiple comorbidities, multiple other illnesses that most likely did not allow them to gain full immunity Again, that percentage, if you compare it to the numbers of people vaccinated in our area versus the number that we've had come to our hospital who had been vaccinated, is less than 5%. We will continue to monitor what that percentage is, and it will take quite a while, several months, to kind of get an idea. What is the overall effectiveness of the vaccines? Pfizer and Moderna are 95% effective at preventing you from getting the disease. They're pretty close to 100% in keeping you from getting severe illness out of the disease or going ahead and progressing. Johnson & Johnson, same song, second verse, very effective in preventing you from going forward to have very severe disease, but not a guarantee, okay? The vaccine is still your best chance that even if you contract it, that you will not become severely ill and succumb to your illness. Not perfect, but it's the best chance we have.